My name is John Dubas with Premier Marketing, and we'll be spending the immediate future here discussing what isn't covered by Medicare and how that helps us sell. Today's presentation is being recorded and will be made available to everyone who has expressed interest in today's presentation. You notice in the software system, it does have a section for questions and chat. We normally cover the questions through the course of the presentation, but we'll make certain to address those in as timely a fashion as possible. As a bit of a level set, let's talk about who Premier Marketing is. Very briefly, we're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform, with offices across the country. We're licensed in all 50 states, acting as an insurance wholesaler through independent insurance agents such as yourself, with contracts at the highest possible commission levels and recruiting contracts available to those who qualify. We work through a full portfolio of products that include the base Medicare health programs, including Medicare Advantage, Medicare Supplement, and standalone Part B drug programs. But we also have a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, which we'll discuss a bit today as well, disability income plans and ancillary benefits, including dental, vision, hearing programs, critical illness cancer plans, hospital indemnity, accident and telehealth programs. The Medicare Advantage programs include all the national carriers and many of the strong regionals that make a difference for you in your market. Same philosophy for the standalone Part D programs, where these are generally part of the MA contract with a couple notable exceptions, that being Mutual of Omaha, which is a separate program from any of their other offerings for their prescription drug plans, and the Clever RX program is actually a discount program instead of a regular prescription drug plan, a Part D program. Medicare Supplements, full portfolio of products, great support in this area as well, and that carries over as well into the ancillary products, where in each of these categories, the national leaders are there for you, not only to create additional marketing opportunities and commission opportunities, but most importantly, to address the needs of our prospects and clients in each of these areas. When we look at the Medicare market overall, you look at the aging of the baby boomers, the silver tsunami, a near exponential growth. But what we're seeing is a number of folks that are delaying accessing full Medicare benefits for one reason or another. It might be pandemic related. It might be a tail end baby boomers who are waiting for age 67 to get full Social Security. Whatever it is, it changes this number, but that's affected by this number, where 15 to 17% of the Medicare population is under the age of 65, accessing benefits because of disability. And we need to make certain that we're looking at the entire package, because the population does have challenges with their health and their income, and we want to help them with the choices that they make, because they have a multitude of ways of addressing the shortfalls in original Medicare, our topic for today. Some of them will pick up a standardized, modernized Med Sup to help with some of the medical expenses and add the Part D drug program. Some will self-insure for the medical expenses one way or another, and some will bundle into Medicare Advantage programs. But in each of these choices, there are still shortfalls we need to address with the population we serve, and hence our topic for today. Folks are choosing some things fairly standardly across the board when it comes to that base medical. And so we want to make certain that we're prepared to interpret what they are looking at with information, and sometimes that means translating the acronyms. This is a site that CMS has, or a portion of their site, that does just that. I've been in this section of the world for longer than I care to admit, and every now and then there'll be an acronym pop up and you go, gee, what does that mean? Look at that number, 4,420 acronyms. My mental capability is strained to handle that sort of number. So we want to make certain that we not only are able to interpret these numbers, but remember that we should minimize our use of acronyms in our presentation so we are properly communicating with our audience. When we speak of the different regulations in the Medicare world, because there are a ton of them, we know, many of us in the Medicare world, about the standard election periods and how that can be affected by special election periods. And there are a ton of them that are standard, it seems to be, or extras brought about by weather and other circumstances. There's actually a set for Nebraska based on wind, believe it or not. So different things can give us an opportunity to address the base medical, which we need to do year round, simply because folks aren't doing a comparison year over year as we should. The majority of people, no matter what their base program is, aren't really looking at some of the changes that come about year over year. It affects some of the more vulnerable groups. We want to make certain that we then deliver upon information to help them, particularly in the areas of their financial exposure, be it through base medical or drug programs or the other things that they assume Medicare covers that is not. And that gives us the opportunity and to leverage government programs because they're not using them either as a third party influencer, but we then can deliver upon information virtually or in person, whatever is necessary to get the information to our prospects and clients so they understand what we're looking at and what they need to do moving forward, and having the capability and the systems to be able to deliver upon that information either in person or virtually can be very important. And we have an audience that is becoming increasingly savvy in this area because let's face it, over the last 2, 3 years, they've been trained to do so by their doctors, by hospitals, by dentists, their faith-based organizations, whatever it happens to be. So folks are much more open to receiving information in a number of different fashions. So let's look at what isn't covered by Medicare and how that helps us sell. We have a variety of ways of reinforcing the message that we have when it comes to what Medicare covers and what it doesn't. And the government does a pretty good job in many circumstances of delivering information in a fashion that is comprehensible. The challenge is it's not being accessed. So we can utilize some of the various tools to make them aware of the needs that they have, and some of them may not even be aware of those needs because, well, they're not looking at them. And we want to make certain then that we use, and I don't mean this sacrilegiously, the Bible for the Medicare world, the Medicare and You book that everyone on Medicare receives in October, be it an actual physical copy mailed to them or an electronic version. And this is a point of reference that I encourage agents to have as part of their presentation packet as a influencer on the back end as well, in addition to your regular presentations. It gives us then the opportunity to look at what is the shortfall in the base coverages to start with. What does Part A cover? You know, when we go into the hospital, how does Medicare take care of that? We look at then what Part B covers and what it doesn't, and how do we take care of that shortfall? Because we have deductibles and coinsurance that are affected, that affect the population we serve, and they may not be aware of that fact that they need additional help unless they're prepared to self-insure. And let's face it, an earlier slide we saw shows that most folks don't have the funds to do that. That self-insuring, that's a bit of a gamble. And we want to make certain then that they realize there are things that they can do to cover that shortfall, be it through a standardized, modernized Medigap policy for some of the base medical coverages that does away with the need for adhering to a network. And we have electronic tools then to help with that decision process. Through our Medicare Center program, it gives us the opportunity to go in and quote different Medicare supplement programs, make information available to our prospects and clients in a compliant fashion, and deliver that information as to here are some choices within a choice that can help you with medical cost. Because, hey, it's going to happen sooner or later. We then have also information available to look at the other side of the option that we saw in the choice slide a little earlier, where Okay, I want to make certain I have coverage. I can't afford some of the premiums on the standardized, modernized Medicare supplement plans. Do we have alternatives? And for many people, this is a very good choice. It's very important for us to realize that regardless of the options they have for covering that shortfall on medical expenses, we need to realize that there's no one answer that's perfect for everyone on the Medicare programs. And so our Medicare Center program allows us to dispense that information. Remember that slide, delivering it in person or virtually. This allows you through a system that has a singular universal login to access 3 quoting engines powered by Connecture, Sunfire, and CSG, and have other tools in there that can deliver information you need to deliver to your prospects and clients so they have a reasonable expectation of what's going to happen and of the choices that they have. It allows you to do those side-by-side plan comparisons, and before you do that, collect the scope of appointment and store it for that 10-year period if you sell it or not in order to remain compliant. Some folks will say, well, hey, I sell med sups. I don't need to worry about that. True, if you talk only about med sups, but let's be honest, most of the time you talk about a med sup, they're going to want to know about medication coverage as well. We want to make certain that we stay compliant regardless. And it's a great way to set up a cross-selling conversation because of the programs that are listed on that scope of appointment. This system also has a CRM for you to track your business and stay on top of it, and has other resources such as sales scripts, other things that can be very helpful for you in presenting information to your prospects and clients. So when we go into the Medicare and You booklet, one of the first things that we see that is of grave concern to people on Medicare are their medication coverages. And some of them will assume that, hey, I go on Medicare, I'm going to have coverage for my medications automatically. We all know, in a very technical term, that that's a bunch of hooey. It's a decision they have to make individually for programs offered by private insurance companies under the Part D prescription drug programs that need to be evaluated individually per the individual circumstance in order to make certain that we have that coverage in play. Hence, one of the big reasons why you want that scope of appointment that comes into it. So if we look at that grand Medicare and You book, this is on page 57, lays out there for you. It once again gives you the opportunity to use different systems, our proprietary system through Medicare Center to compare programs for standalone Part D programs and the Medicare Advantage programs as well. It then gives us that opportunity to set up expectations through that scope of appointment and look at other possibilities of cross-selling. There are limitations as to what products we can speak to on different appointments. They have to be health related. So if we go into life insurance or long-term care or some of the other programs that aren't considered a health program by this system, and not this actual electronic system by the government systems, we want to make certain that we adhere to the 48-hour cooling off period, but then make certain we have set up expectations as to how we address that. It's also important to note that there are many things on Medicare that I refer to in terms of Clint Eastwood's movies, The Good, the Bad, and the Ugly. What happens within certain needs that people have. And one of the things that concern a lot of people are cancer. And with that, standard, just regular Medicare, chemotherapy is 20% of out of pocket after the Part B deductible. So it gives us then the opportunity to speak to critical illness and cancer plans at this particular point in time as well, or look at other alternatives to cover that cost. What you find on the Medicare supplement programs is it'll take care of that 20%. If you look at the Medicare Advantage programs, in many cases, the chemotherapy is still a 20% exposure financially, and we want to make certain we address that. And because the scope of appointment does allow for this as a health program, we can still do this as part of the conversation on our initial appointment. One of the other things we want to make certain we have available, because of some of the challenges the Medicare beneficiaries have when it comes to income and assets, is an awareness of the special needs programs, a subset of the Medicare Advantage programs that allow us to market year-round, but also specifically address needs of certain vulnerable groups within the Medicare community. And that includes people that are challenged with certain chronic conditions. So we look at chronic special needs programs that give us the opportunity to address that need year-round, and also look at the folks that may have some challenges with their budgets. Well, budgets being too much month and not enough money for assets. And we look at the dual beneficiaries with the dual special needs programs. And these are programs, in many cases, with enhanced benefits that allow us to specifically address the needs of this population as well. We got a ton of tools out there that can help us do that. Many of the Medicare Advantage carriers partner with Benefits Checkup to help with these programs. A couple of the carriers have their own systems to do that, and it allows us to look at the vulnerable populations and see what we can do to positively affect their life, plain and simple, regularly through some of the additional programs that may be available to them based on their own qualifying factors. Some of the things that really come into play, however, that can help us in this area, it's on page 55 of the Medicare and You 2022 version as to, wow, gee, John, where'd you get the title for today's presentation? What's not covered by Part A and Part B? It lays it out here for you. And many of these are the things that we look at and feel a strong need for on a regular basis. And we have programs available as part of our portfolio to specifically address this shortfall. And that includes some of the things we hear a lot about with the DVH programs. Thanks, John. You used an acronym. What the heck are you talking about there? Dental, vision, hearing, where these programs can deal with benefits that aren't offered as part of original Medicare that people may have become accustomed to as a part of their benefit package through work, or are looking forward to as an assumption as to what Medicare is going to do for them once they get on the program. Well, here's an idea here for you, Sunshine. Some of the base programs with us, it's not going to happen unless we speak to that, make them aware of this shortfall of what is available to them or not available to them, and how we can make certain that the programs we have as part of our portfolio can address this shortfall. It is also available as part of that Medicare Center program that gives us that cross-selling option to go into some of these programs with dental or even hospital indemnity programs to cover some of the extra expenses people have when they go in the hospital, be it a financial obligation as part of a Medicare Advantage program, or gee, the non-medical stuff that just comes as part of a hospital stay. This, however, is an area that we really feel is something we need to speak of and make certain that we do both discovery and a proposed solution, because many people will assume that Medicare covers long-term care. And what we all know is, hey, it doesn't. And so we've asked a special guest speaker to come on and give us a little bit of detail on long-term care and how we can address that. Katie Novotny is our expert in this area. And Katie, I thank you for bearing with me as well to come on to the program and make certain that people realize the portfolio of products that you have available, but as importantly, the different training and information that you make available to our agents in this area. So a brief little analysis here on your part, if you would, Katie, for us.
Sure. Thanks, John, for having me. When it comes down to long-term care, I think that that's commonly a misconception that there is a need for it, and more importantly, there's a need for looking for some solutions. Where we have found here at Premier, we do have a multitude of solutions when it comes to solving it. Whether we use a life insurance annuity chassis, we use the traditional long-term care, or we also have a plethora of short-term care options. When I say short-term care, basically it's going to have long-term care services, but this is really designed for people that are planning, maybe they have a significant health history, maybe they're a little older, they have fixed budgets, or they just don't want to spend a lot of money. And we found a lot of people that walked away from the long-term care industry. So we have also found the short-term care has kind of brought them back and looking at their client's portfolio and maybe some holes, of course, with what Medicare is not covering. And we do have some affordable options there. Things that we do here at Premier with the long-term care policies is we'll help you from beginning to end, whether it's making sure that you have your certifications, your licenses, or proper lines on your license, depending on where you live and what you're looking to write, along with case design. We do all pre-qualification in-house, and if you do stump us, we do have a bunch of underwriters in the background at all the carriers that we are in constant contact with. From there, we also will help you receive the marketing paperwork, all the illustrations, any kind of different case designs. And once you would submit your first piece of business, then we have a full case management team. They'll walk your application from start to finish all the way till it's time to issue the policy. And we will also assist with some policy delivery receipts and requirements on that nature.
That's awesome, Katie. One of the things that comes up a lot of times in this area, and it's the other half of the question of, okay, how do you address this shortfall? You can buy private long-term care insurance, or you can depend upon Medicaid. How do you respond, or how do you coach folks to respond to, do you really want Medicaid to be your option for long-term care?
Sure, we get this question all the time. Medicaid does provide the nation's, the majority of the nation's long-term care needs. However, we all know that Medicaid can only withstand so much. That being said, there are a variety of options that we're seeing. The biggest thing we've seen in the last 2 years is the utilization of home care services. We at Premier have 4 different companies that offer home care only policies. Long-term care solutions and Medicaid and Medicare options, those require the facility side of it. Most people after the pandemic have seen the media. They are afraid of leaving their family and having to go into a facility where if something did happen, maybe they couldn't have visitors or have the frequent social interactions that they're used to. People are wanting to stay at home. We're actually hearing kind of a connotation that we want the anti-nursing home policies offered right now, and we have those. We have so many policies right now that are offering home care only and also on a cash basis. So we are seeing informal and formalized care, including the custodial care that Medicare nor Medicaid will cover.
Awesome. And I'm going to throw out this last little piece. There is a segment of the Medicare population that has served our country as well. And many of the veterans feel that they are able to get long-term care through a VA facility. And we realize in many circumstances that that is dependent upon an available bed, an available facility in the area, and also timing. So regardless of the circumstance, I urge people to speak with Katie about the different needs that their population has when it comes to long-term care and speak to this program. Anything else, Katie, that you would like to add?
No, I think that you nailed it on the head, though. I think that there's a lot of limitations. There is care provided by the VA. There is care by Medicare, Medicaid, and various other things. However, I think there's limitations to each. And when we plan long-term care policies or some form of a solution for any of our agents, we ask those questions. We're actually asking what the client wants to have in the future. Sometimes we will utilize the Medicare benefit and just simply have a supplemental sale right with it, providing the full solution that they're asking for. So I am happy to walk through any of those with any of you. And like I said, we're here to help you have each solution for your client when you walk into that door.
Awesome. Thank you, Katie. I will urge folks to go into our library of recordings of different webinars and look at some of the presentations that Katie has done in this regard, and make certain that you view it at your time. You know, it's the lovely available 24/7. There's a ton of really good information out there for you, and Katie stages regular presentations as well. And we want to make certain that folks look at the different possibilities and they realize long-term care is not covered by Medicare, and don't confuse skilled nursing care or a SNF stay as long-term care. So a number of different things that you have an incredible resource here at Premier Marketing with Katie Novotny to help us with this terribly underserved need. And so watch for that information as well. You've got different pieces of information available to us from the government as well that helps illuminate some of the shortfall and how you can look at different options. And this is also a very valuable tool to have as part of your presentation briefcase, whether you go through it in detail or not. And keep in mind, this is one of the programs that you would want to set up a second appointment, even if you were able to present when you do some of the base medical, which you can't. But in this circumstance, you want to get that detail so you can go back for further and propose different solutions for this as well. So watch for that. It also has the different information in there for you for skilled nursing facility care that I briefly alluded to a bit earlier, and gives you the opportunity to help folks understand the differences between level of care and what is and is not covered. One of the other things, of course, that Medicare doesn't cover is burial. And many folks will assume that that's going to be taken care of, if not by Medicare, but by Social Security. We all, well, many of us are very cognizant of the fact that there's a whopping one-time lump sum death benefit of $255 for folks that qualify for it to help with the death benefits. And we realize that that is, well, that doesn't even buy the spade, so to speak. And we want to make certain that systems we have in place to address that can be very helpful for you. So if you're not familiar with Legacy Safeguard and the planning process that it allows you to go through, I urge you to take advantage of that system in conjunction with some of the carriers that are helping subsidize that cost. And one of the ways that you will determine the true value of the system is to do it for yourself. Gee, John, are you asking for money for this? No, it's available without cost to our agents. That allows you to do that. And it's a great way to work a proper solution for final expense and the tidying up of the end of life expenses. It is one of the programs available, once again, through Medicare Center's CSG tool that allows you to do some different quoting on final expense as well. We do strongly recommend that you look at different trainings across the board to prep for each of these areas. And one of the first things is something that is a bit of a burr under some folks' saddle, so to speak, and that's the annual certification for the Medicare Advantage and PDP programs. You can look at that as a bit of an onerous task that, gee, that takes a lot of time every year. But one of the things that enables you to do is stay on top of different changes, make certain that you are reinforcing within your mind what is and isn't possible through these different programs, and make it available to you. It also gives us the opportunity to roll into different programs that allow us to market. Many of the carriers will offer their own retail program in addition to, boy, gee, by the way, Walmart's already rolling out requests for next year, well, this coming fall for retail, but it allows you then to align yourself with carriers that will support you in your market and make certain that you are doing everything you can to establish yourself as a subject matter expert within your chosen target market. And that rolls into some of the grassroots marketing or working your target market, how you can be effective in establishing yourself in a geographic area, maybe expanded greatly through virtual work, but it then gives you the way, a means to maximize the return on your investment in retail and other programs. Knowing some of the specifics about the assistance programs, we looked at, gee, there's some challenges with income and assets here with the Medicare population, John. Look at some of the low income subsidy and Medicare savings information. You don't have to memorize the numbers. We got great ways of making certain that you have reference material. Had a presentation yesterday on low income subsidy. National Council on Aging gives you some great information in a synopsis that allows you to go through and speak to those programs intelligently and accurately and deliver upon them. Those electronic tools we have can be very, very helpful for you in presenting comparisons on a compliant basis, satisfying the needs beforehand of making certain that you're doing what you need to do to stay in compliance. Knowing how to work Medicare.gov, that can be pretty helpful for you because it is a third party influencer, but keep in mind, it's not a sales tool. And we want to make certain that we're able to address things properly and deliver upon it. So watch also for a nice program that we have on maximizing your leads through referrals as well. Not only in the new sales process, but on how that can influence your retention and persistency with your book of business by going back and addressing that need for you through your book of business. There are trainings available too through the government on the Medicare Learning Network. This is a great source for you to use for presentations, be they live or a webinar presentation on different topics. And we have a ton of those available to you from this source and other means that we access these, so you can present on a regular basis to your target market wherever it happens to be. That reminder, once again, you don't want to put all your eggs in one basket regardless. And we need to realize we need to be flexible and be able to address the needs based on our client's capability. Can they afford certain programs? How does this come into play and how does it fit their individual circumstance? And because of what's going on in the world in the last couple, 2-3 years, are we prepared to do virtual meetings or in-person meetings? And having software packages like what we deliver here at Premier Marketing that enable you to do virtual presentations or deliver the information however you need to do it in order to get the information to our prospects and clients can be very, very valuable for you. So let's integrate things into a comprehensive program. Look at the different ways of reaching into the community through cold calls when possible and compliant, the different things that we can do in the community to reach the population that may respond to certain outreaches and not others, and how we can leverage the carrier support and the brave new world of the internet. Brave new world. Well, Aldous Huxley is going, it's not that new, John. How are we going to leverage social media and some of the more traditional ways of reaching out to the population? We have systems here at Premier that can help you with those areas as well, creating an agent profile so you can make certain that you have the full portfolio of products to deliver upon what is needed on the shortfall of Medicare coverages. Great way to do this electronically. We also offer discounted errors and admissions coverage for qualified agents. What's a qualified agent? Well, you got a contract with us. But this isn't adding you to a blanket E&O for one program. This is something you own and covers you, satisfies the requirement that insurance companies have for this coverage. It's your malpractice insurance, and it'll cover you regardless of whom you contract through. Because let's be honest, no marketing organization has every program in the world, and we want to make certain that we're protecting you as well and making certain that your license stays in play through discounting continuing education programs through our association with WebCE. You do also have the opportunity to add to your own coverage through a modified guarantee issued DI program, disability income plan, for yourself, in which you are paid a commission. So something to consider when you look at protecting your own ability to earn. Much as where today's presentation is being recorded, after we chop it up for the first part, um, the past presentations have been recorded as well. They're available on our website and on our YouTube channel. And this is one of the things I strongly urge you to go in and look at, particularly when we look at other areas that you may not have attended in the past. Look for Katie's long-term care programs, DI programs, the different things that are offered in that area, long and short-term care programs, I should say, final expense, life insurance, other programs that are out there that can help you with your overall marketing efforts and make you comfortable with filling those holes in the Medicare coverage. I'm going to lay out a little bit here when it comes to the Medicare Center program, because I haven't mentioned what this costs for you as a contracted agent with our organization. It's a big round zero. You have a contract with us and on our integrity partners. It allows you access to this system without cost, with all of the details we've already gone through and how this can be so effective for you. Gives you that ability to cross sell, and that then drives up your retention, drives up your persistency. Because keep in mind, studies have shown that the more programs you have in a household, the higher your persistency. They don't have to be with the same company, they have to be with the same agent. And we want that agent to be you. So you have the renewals that give you a bit of comfort and drive through holding on to your prospects and clients. Some of the programs will offer additional incentives. We have a page on our website devoted just for that. So you understand the full compensation available to you through incentives or trips, and how that can help you qualify for premier incentive programs as well. Lead programs, everybody needs and wants leads. We have these different systems that come into place that can make available to you call list, ways of addressing community-based programs, carriers, internet programs, direct mail at T65 Locator and referral programs. Direct mail is based on production, drives down that cost. You can qualify for it in two different ways, through health programs and through final expense, and that gives you the ability to market in this fashion consistently. We do so through different lead vendors that are vetted to make certain they have the systems to support this program for you, and gives us oversight for compliance as well. For those that don't want a full mail program, we do have an opportunity for you to access mail responses, untouched, fresh. Costs will vary by area to area, time of year, that sort of thing. It's a supply and demand thing, but it's a great way to fill your calendar across the board. Internet lead programs, they're Facebook based for final expense and Medicare as well. And at T65 Locator, for those of you that are of the notion of door knocking, well, you can do that for certain programs. Some, yeah, you can't. This actually helps you identify geographically where these folks are located. Free tool. You download it on your smartphone, register for it. They verify that you have contracts with us. It's available to your use without cost. We do all this because we do want your business. We want to be referable for you. We want you to have a source for all of your needs within the insurance world. And so make it part of your program to look at the different portfolio of products and put it in play as quickly as possible. We look at some of these other offerings that are available to us. It's pretty quick to be up and going with some of them. Now, you have certain requirements in long-term care when it comes to some of the educational portions ahead of it, but as you do with Medicare Advantage plans, but you have the opportunity to sell many things very quickly and create additional revenue streams and marketing opportunities. So all that said and done, after all has been laid out there for you, I'm going to check very quickly to make certain that I didn't completely miss every questions that were out there. Nope, we're pretty good. I thank you once again for your valuable use of your time. Thank you for your understanding as to our late start. I appreciate the opportunity to get you some additional information, and thank Katie for her contributions as well. For those of you that have done business with us in the past, I thank you for that business. For those of you considering doing business with us in the future, I thank you for that as well. And until we're able to visit once again in the future, I wish you good selling. Thanks so much, everybody. We'll talk to you soon. Watch for the follow-up. It'll be coming and will be available through your marketers within our organization as well, in addition to the websites we have referenced. Thanks once again.